Hello guys, so today we shall be discussing one of the important topic in virology, right? So before telling you the name of this virus, let me tell you a small history about this virus. So the basic history is that in 1971, okay, in 1971, a patient came to the clinic, right? So he was complaining of some kind of urinary troubles, like there's burning sensation while urinating, right? He is unable to urinate, there is increased urinary frequency, or he also told me that doctor, early in the morning when I go to the urine, I see blood coming out of my urine. So all these complaints. So upon examinations, doctor found that the patient is having renal failure. The patient is having renal failure. Not only renal failure, he was also having a renal blockage. That is the reason why he was having difficulty in urinating. So there was also renal blockage. Okay, that was also renal blockage. So the name of the patient whom they found in 1971, his name starts with capital letters B and K. His name is not given anywhere, but his name starts with B and K. And this particular renal failure and renal blockage is caused, they came to know to a conclusion after doing some PCR, the polymerase chain reaction. They came to a conclusion that, how did they come to a conclusion is that they have collected the urine sample and under microscopic view they have found some dead cells. So they have taken those dead cells and they have seen those dead cells and they found that there is some virus within those dead cells, right? So they don't know what to name this virus, and they asked the patient, what is your name? He told that my name is BK. So they named this virus as BK virus. So I'm not just framing it up, this is the real story what has happened. So BK does not have a particular meaning, but BK is the first two letters of the patient who was first infected with this virus in 1971 with the complaints of the renal failure as well as renal blockage. So our topic of discussion today will be about the BK virus. It will be about the BK virus. So what is this BK virus? All of you remember one thing, by now all of you came to know that BK virus mainly affects your what? It mainly affects your urinary system. It mainly affects your urinary system. So who is affecting your urinary system? BK virus mainly affects your urinary system, right? So what family does this BK virus belongs to, guys? BK virus belongs to Polyomavirus. It belongs to a group of family that is called as Polyomavirus. Polyomavirus. So to the family of this Polyomavirus, this BK virus belongs to. So if you ask me what is the shape of this BK virus, I will be explaining you the pathogenesis, how is it causing a disease, how is it transmitted, and okay fine, once this BK virus enters into your body, what is going to happen and everything, I will be explaining it to you in a minute. But before that, let us finish up all these things, right? So what is, how does the structure of the BK virus look? So if we are talking about the structure of what, guys? Structure of BK virus. So if you look at the particular structure of this virus, guys, how does it look is that, look here, whatever I'm drawing right now, I hope all of you know that this particular shape is called as a hexagonal shape. In the center of the hexagonal shape, I'm going to draw a triangle. Okay, so I'm going to draw a few lines. Just concentrate here. This is one line, the second, the third, right? This is the fourth, this is the fifth. So this is the picture exactly, right? So what is this entire structure which I have just drawn in front of you, guys? This structure, you basically call it as icosahedral shape. What is that shape? Icosahedral shape. Icosahedral shape or icosahedral capsid, right? Icosahedral shape or icosahedral capsid. So if I remove all of these things, and if I purely draw the shape of this, that was the shape exactly, but I'm removing all these lines and I'm showing you what is inside. What is inside is that there is a DNA inside. And how does the DNA look? Look like this. This is how the DNA looks. Can anyone tell me what is this structure of DNA, guys? Is it circular? Yes, it is circular. Okay. So what is the shape? What is the shape? Can you describe it? This is circular DNA. This is a circular DNA. And tell me, is it a single stranded or double stranded? Obviously, it is a double stranded DNA. And tell me whether this DNA is enveloped or not enveloped. Obviously, this DNA is non-enveloped. Non-enveloped. So, what are the three important things? The three important things are that this is a circular DNA, this is a double stranded DNA, this is a circular, double stranded, and it is a non-enveloped DNA. So, if someone asks you, can you tell me the characteristics, the morphological characteristics of this, or simply the structure of this BK virus? Yes, BK virus is icosahedral in shape. And what is the genetic material? Genetic material is a double stranded DNA. And this double stranded DNA is not covered by any kind of envelope. It is a non-enveloped double stranded DNA which is circular in shape. So this is all you need to tell about the BK virus. Now coming to the transmission. Do any one of you know how this BK virus is getting transmitted? What is the transmission route of this BK virus? Very simple, guys. BK virus is mainly transmitted through respiratory droplets. Okay, so BK virus is mainly transmitted through respiratory droplets. So I have that BK virus. I am infected with that BK virus. If you stand in front of me and when I try to sneeze or cough, through the respiratory droplets, you might get affected. So this is called as respiratory droplet transmission. So when we enter into the pathogenesis, right, what did I tell you? I told you that this BK virus mainly affects your what? It mainly affects your kidneys, the urinary system, right? So you are telling that this virus spreads through respiratory droplets. So what is the relation between the arteries in the lungs, or I mean the lungs and the kidneys? How is it going to go all the way from the lungs to the kidneys? So concentrate on the picture which I am drawing here, guys. Just a simple picture. I will elaborate it later on. I am just drawing a rough picture of that. Right. So all of you know that this is your nasopharynx. And here comes your oropharynx. The nasopharynx and the oropharynx, all of them together, they form laryngopharynx. And this laryngopharynx continues all the way down, right, and it divides into two bronchi. Okay, so here, exactly here, you have got your beautiful lungs. These are your beautiful lungs, right? And another important thing is that beneath this, you have got an artery over here. Can anyone tell what is the name of this artery? Let me tell you in a simple way that this is a pulmonary artery, for example. Okay, so this pulmonary artery, where is it going? This pulmonary artery goes all the way down like this, and down there, remember, you have your heart. So this is the heart which is located down over there. Clear? So where is this pulmonary artery going? Pulmonary artery is converted into what? Pulmonary vein. And this pulmonary vein drains into your left heart. So the blood all the way, you know this simple thing, the blood all the way from the pulmonary artery goes down into the pulmonary veins. From the pulmonary veins, the blood is drained down into what? Your left heart. I mean the left ventricle. So from your left ventricle, what comes out of your left ventricle is very important. Can anyone tell me what comes out of your left ventricle? What comes out of my left ventricle is this arch-shaped aorta which I am drawing. So this is the aorta which is coming out of my left ventricle. So this aorta descends down all the way like this, all the way, and it gives out a small branch. And what is the name of this branch? This branch supplies to your kidneys. So you call this as a renal artery. What do you call it as? A renal artery. So let me draw the shape of the kidney, right? So this particular thing which I am drawing right now, this is your beautiful kidney. Beautiful kidney. This is your renal artery, right? So, I always have to mention the things. This is called as renal artery. I hope all of you know that, right? So, what is the story? You have drawn enough, but tell me the story. The story is that respiratory droplets has got this virus called BK virus. I am mentioning this BK virus in this way. I am representing in this way. This is the BK virus. So, this BK virus enters into your respiratory tract. So, all the way this BK virus travels down like this. It travels down, 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 and finally this BK virus enters into your lungs. Okay, it enters into your lungs. From the lungs, this BK virus is transmitted into the pulmonary capillaries. So, you have got your BK virus all the way in your pulmonary capillaries, I mean the pulmonary artery. So, within the pulmonary artery, the BK virus travels like this and enters into pulmonary vein. From the pulmonary vein, it enters all the way into your left heart, and from the left heart right now, guys, I am changing the color, that your BK virus, I am drawing it with the violet, right? Your BK virus is in the aorta. So, this BK virus travels down all the way and enters into your renal artery, and that is how the BK virus enters into your kidney, damaging the kidney, leading to a condition called as nephropathy. Nephropathy, right? So, I don't want you to leave with a confusion that how respiratory droplets is going to cause nephropathy in the patients, right? So, I hope now we are clear with the concept. Anyways, the explanations might be huge, but it is worth explaining, right? So, it causes nephropathy. Okay, important thing. Question number one. Question number one is that you told me that this BK virus affects your kidneys leading to nephropathy. Can you exactly tell me what type of epithelium or what type of cells or what structures in the kidneys is this BK virus going to affect? Yes, this BK virus mainly affects two important structures. What are these two important structures? Structure number one, that it affects uroepithelial cells. Uroepithelial cells. And the second one is it affects renal tubular cells. This affects renal tubular cells. What are uroepithelial cells? What is your concept of uroepithelial cells? Concentrate here. This is your urinary bladder. Okay. So, both the ureters on both the sides coming down and forming your urinary bladder. This is your urinary bladder. Now, urinary bladder continues as what? Not rectum. Urinary bladder continues as your urethra. Where are these uroepithelial cells? Uroepithelial cells are located. See, I'm putting a dot here. You have to know it. Uroepithelial cells are located here. What is this called as? This is called as renal pelvis. And this is called as ureter. And this is called as urinary bladder. And this is called, the lower portion is called as the urethra, but not all the urethra, just the upper portion of the urethra, just still the upper portion of urethra. So, in the renal pelvis, in the ureter, in the urinary bladder, and in the upper portion of urethra, in all these areas, you have got what type of cells, guys? You have got a special type of cells. Those are called as your uroepithelial cells. And where are renal tubular cells located? Obviously, you know where is renal tubule located. You are studying it from your 9th or 10th class, I think. Renal tubules in the sense your PCT, your loop of Henle, your DCT, your collecting duct, all this is a renal tubule. They are located in the kidney. So, the lining them, these cells are called as renal tubular cells, as simple as it. So, this this guy, I mean this virus is going to affect uroepithelial cells as well as renal tubular cells. Keep these things in mind. This is going to affect question uroepithelial cells as well as renal tubular cells. Okay. Now, another important thing. Let me, the same thing, now I will be only focusing on the virus, how it is affecting the renal tubular cells. Okay. The same mechanism will be applicable for the virus affecting the uroepithelial cells also. Okay, instead of telling what is happening in uroepithelial cells and renal tubular cells, I'll choose any one of them and I'll explain you. The same thing applies for the other. I'll choose renal tubular cells. Look down what is going to happen. What is exactly going to happen is that this is your kidney. I mean, this is your glomerulus. Not glomerulus. What is this? Bowman's capsule. This is your proximal convoluted tubule. This is your loop of Henle. Here comes your distal convoluted tubule. This is your distal convoluted tubule. So, lining them guys, lining them, you have got some cells. These are called as renal tubular cells. These are called as renal tubular cells. Okay. And there is also a blood vessel adjacent to this tubular cells, for example. Okay, there is also a small blood capillary, for example. So what I'm going to do is that the same picture I'm going to draw it down, just focus that. I'm going to draw a line, right? And even I'm going to draw the renal tubular cell like this. Okay, and next what I'm going to do, I'm even going to draw a blood vessel. Right. So what did I tell you? What I told you is that this virus, BK virus, this virus travels all the way down from the PCT, from the loop of Henle. It even damages the cells of PCT, cells of loop of Henle. It even damages the cells of distal convoluted tubule. And finally, this BK virus enters into the renal tubular cells. Once after entering into the renal tubular cells, what is this virus going to do? Look here. So this is the BK virus. Once after entering into the renal tubular cells, this BK virus starts to divide. So this BK virus very happily it starts to divide. Okay, this BK virus very happily it starts to divide. Now, as this virus is replicating, do you know what happened? What happens is that within your blood vessel, you have got very specialized cells. They are called as CD8 T cells. Can anyone tell me what is the other name for these CD8 T cells? They are also called as T killer cells. T killer cells. And these CD8 T cells from the blood vessel, they enter into the renal tubule and they start damaging or destroying this what? BK virus. So BK virus is dead. Kidneys are safe. But BK virus is so intelligent. You know what it is going to do? What it is going to do is that, for example, on the other hand, you have got this BK virus, right? This BK virus knows that if I start to divide from the blood vessel, the T killer cells are going to come and kill me. So let me keep calm for some time and then let me show the effect on this guy. So this BK virus will not divide, it will stop replicating, right? BK virus is stop replicating, which means BK virus is sleeping. It means BK virus is in which phase? It is in a latent phase. It is in a silent phase. Okay. So this particular BK virus, what does it do is, it will enter into a specific phase and that phase is called as latent phase. Latent phase. What is latent phase, guys? Latent phase is that phase where there will be no what? No division, I mean no replication. No replication of bacteria. Bacteria is silent. It is completely sound sleep. Right? Now, this bacteria will wait. This bacteria knows that one or the other day, this guy's immunity gonna be low. So when his immunity is low, his T killer cells will be low. So when his T killer cells will be low, that time I will start attacking him. That time I will start dividing him and then attack him, because that time no T cells, so T cells cannot affect there. So that time it will start to affect. Till then the BK virus stays in a latent phase. This is point number 1. Point number 2 which you need to understand is that, for example, let us say I am affected with HIV, right? I am affected with HIV, human immunovirus. So in HIV, all of you know what cells count will be low. Obviously, the T cell count will be decreased. Isn't it a good thing for this virus to divide? Obviously, virus is attacked by T cells. So if you are decreasing the level of T cells by HIV, I mean by immunosuppression, then obviously the virus will divide. So HIV is an immunosuppressed state or immunocompromised state, right? A. Next, B. What is B? For example, let us say today I got my new liver. Let us say I got liver transplantation. So when someone is giving me their liver and I put that liver into my body, then that liver is going to become foreign to entire my body. So all my immune cells will go start attacking. Oh my God, from childhood onwards I did not see such tissue. So this is a completely different tissue. So let's start attacking it. So my immune cells will go and attack there, right? So whenever I have any kind of organ transplant, in that particular cases of organ transplantation, what is going to happen? What is going to happen is that my immune system will cause damage of that. I mean, my immune system will damage that organ. It will go and attack that foreign organ, and that is what is called as organ rejection. So then what is the use of transplanting? If organ is getting rejected, what is the use of transplanting? Can you suggest any other method to prevent this organ rejection? Yes. I will give the patient a drug called as tacrolimus. I will give the patient a drug called as tacrolimus. And what is tacrolimus, guys? Can anyone tell what is tacrolimus? Tacrolimus is an immunosuppressant. Immunosuppressant. It will suppress the immune system. So I got liver transplantation today. From after in the post-op, after the operation, they'll start giving me immunosuppressants so that my immune system will be suppressed and it cannot go and attack. I mean, it will not have that ability to go and attack my new liver, right? So this tacrolimus will inhibit the organ rejection. But you know one important thing that is happening? One side it is inhibiting organ rejection, that's fine. But because of giving tacrolimus, your immune system is getting low, your immune system is getting suppressed. As a result of immune suppression, what is happening? Your T cells are also getting suppressed. When your T cells are getting suppressed, don't you think this is a good thing for this bacteria to divide? Obviously, now the bacteria starts to divide. Now you're going to ask me a question. Now when the bacteria is dividing like this, what about the T cells? I just told you, you are taking immunosuppressants, so there will be no point of talking about the T cells. Okay. Next important thing is that in cases of immunosuppression or immunocompromised state, for example guys, this HIV, whatever I spoke, this is an immunocompromised state. And organ rejection, whatever I told you, this is an immunosuppression state. So one very important thing you need to understand here is that patients, the most common cause of this BK virus affection is that patients having organ transplantation, right? Either they are transplanting kidneys or bone marrow. I told you here organ transplant, but what type of organ transplant? It is bone marrow and kidneys. So if someone asks me, a patient is affected with BK virus, what can be the cause? Either it can be a bone marrow transplant, either he might had a bone marrow transplant the last week, or he might have had a kidney transplant. So most common cause, I mean the higher risk of BK virus affection you see in the people with bone marrow transplantation and kidney transplantation. This is a very important thing. Most common cause of BK virus is that patients with bone marrow and kidney transplantation is the most common cause of BK virus. That is the most common, not cause, I mean it is the most common risk factor for BK virus. Okay, so cool. What is happening here? When the immune system is suppressed, your B cells are, there is no one to attack the B cells, so B cells will divide very happily. So when B cells are dividing very happily, don't you think there are remaining other cells in your body which going to affect? You know what will happen? When B cells are dividing like that, your body does not compromise like that. You know what does your body do? What your body does is that, in your body you have got macrophages like this. And you know what are these macrophages gonna do? You know what are these macrophages gonna do? These macrophages gonna release two important things. One is called as cytokines, another one is called as histamine. Cytokines and histamine. Right. What is this histamine gonna do, guys? Tell me the effects of histamine. Histamine will cause vasodilation, isn't it? Histamine is gonna cause vasodilation. So if this is the blood vessel, and between that blood vessel you see some small gaps. Why there are gaps, guys? Because histamine is causing the dilation of the vessels. For example, if this is my vessel which is closely packed, now when the vessel gets dilated, obviously when the vessel is getting dilated, you see some spaces in between. These are the spaces which you are seeing there right now. So through these spaces, what is going to happen? Through these spaces, your neutrophils, your macrophages and all of these cells can very easily escape and enter into the cells where there is virus. It will enter into the cells where there is a virus like this and start attacking. So macrophages are attacking those cells, I mean the renal tubular cells. Don't forget, this is your renal tubular cell, right? Your macrophages are attacking your renal tubular cells, your neutrophils are attacking your renal tubular cells. So there is a war between your immune cells and the virus. So as the war is happening in a playground called as renal tubular cell, inside that, don't you think renal tubular cell will be affected? Obviously, the renal tubular cell will die. Okay, there will be death of the renal tubular cell. If you look at the picture above, you see here, this renal tubular cell will die like this. You see, this renal tubular cell is gonna die. Okay. When you look at the overall picture, what is going to happen? Look below here. Look below what is going to happen. This is the kidney of the patient. And let us say there are renal tubules like this. This is the renal tubule, right? Not renal tubule. This is, what is this? This is the ureter, right? This is the ureter. What did I tell you previously? I told you that cells of the renal tubule are gonna die. The same mechanism applied to the uroepithelial cells as well. The same mechanism which is happening in the renal tubular cells will also happen in the uroepithelial cells. So where are those uroepithelial cells? I told you uroepithelial cells are located just till above the upper surface of the urethra, right? So even uroepithelial cells are located in the ureters. Yes, there are also uroepithelial cells in the ureters. So can you draw them? Yes. So these are not renal tubular cells, rather these are called as uroepithelial cells. Uroepithelial cells. So look very carefully what is going to happen here. A very important topic is going to come here. These uroepithelial cells are dead. You know why? You know why renal tubular cells are dead? The same mechanism here. The uroepithelial cells are also dead. So when the uroepithelial cells are dead, guys, the damage occurs so severely, that if you look into the later on stages, you know how gonna kidney be modified as in this way. So at this point particularly there will be a constriction like this. You see, there will be a constriction in the center. There is a depression or a constriction in the center. This is called as urinary stenosis. What is this called, guys? This is called urinary stenosis. So what will happen because of that urinary stenosis? What is happening because of that urinary stenosis? What is happening is the urine will stay here for a long time, and the urine will go up like this. The urine will go up all the way, all the way, all the way, and the urine is regurgitated back into the kidneys. So kidneys are sending the urine into the ureters, and ureters are sending back the urine into the kidneys. So what is happening here? There is a lot of urine that is coming back and getting deposited within these kidneys, and at one time what is going to happen is the kidney is going to swell up. Look here how this patient's kidneys are going to swell. You see, this is how the patient's kidneys are going to swell. And guys, don't forget that this condition, you call it as hydronephrosis. What is this condition called as, guys? This is called as hydronephrosis. This condition, you call it as hydronephrosis. Okay. Second important thing is that, look here very carefully. You have got ureters on both the sides, and all these beautiful ureters, they join together to form what? Yes, to form your bladder like this. This is your urinary bladder, and this is your urethra down. Obviously till here the upper part completely is having uroepithelial cells. So there also can be damage within the bladder also. There also can be damage in the upper part of the urethra also, because uroepithelial cells are damaged, I told you in the starting only. Right? So there can be damage in the bladder, there can be a damage in the uroepithelial cells. The damage will be so severe that all the walls of the bladder, all the walls of the urethra, they are completely scratched down. They are completely, completely damaged. So even the damage goes inside the blood vessels, and even the endothelial cells, the blood vessels, everything, they are scratched off. They are sloughed off. They are damaged so heavily. So when they are damaged so heavily, what is happening? From these damaged parts, the blood oozes out like this. So what is happening when the blood is getting oozed out? All the blood will collect together like this. All the blood will collect together like this and form a clot. And this particular clot is called as a blood clot. So I'm not teaching you anything funny here. So what is this blood clot? When there is blood clot here, what is happening? What is happening when there is blood clot here is that the urinary opening is getting obstructed. Because of this blood clot, there is urinary obstruction. Urinary obstruction. So what is going to happen? The urine will stay here. There will be stasis of the urine. Okay. So there will be stasis of the urine. Because of that urinary obstruction, what is going to happen, guys? There will be urinary stasis. There is going to be urinary stasis. And when there will be urinary stasis, what will happen? When the urine is staying there for a long time, what is going to happen? There will be secondary infections that are developed in the patients. Patients going to have secondary infections. Okay, sir, you told me that there will be damage of the uroepithelial cells in the bladder. Yes. You are also telling that there will be damage of uroepithelial cells in the upper part of the urethra. Yes. As a result of that, the blood is getting oozed out. Yes. The walls are getting damaged and blood is getting oozed out. Yes, absolutely. Can you please tell me what is this condition? This entire condition which I have just explained you, this is called as cystitis. But there is blood, so you call it as hemorrhagic cystitis. This is called Hemorrhagic cystitis. Now, if someone asks you what are the symptoms of hemorrhagic cystitis, you have to tell me. Point number one. Point number one is that when the patient is passing urine, along with the urine, the blood is also gonna come out. So patient gonna have painful hematuria. Patient gonna have painful hematuria. Second important thing, patient gonna have increased frequency of urination. Third important thing, these blood clots have obstructed the urinary outflow. So patient's urine, there will be a very difficult while urinating. Patient's urine cannot go out. It will be very difficult because the lumen is completely narrow. So there will be difficulty in urination. So patient will complain that doctor, I have difficulty in urination. Difficulty urinating. And fourth important thing is that as the urine stays there for a long time, when you press the lower abdomen, I mean the suprapubic region of the patient will have lower abdominal pain. Lower abdominal pain. So all these things you gonna see in the patient, guys. So overall, point number one, what are the cells that are affected? Uroepithelial cells and renal tubular cells. What conditions do you see? Point number one, you gonna see urinary stenosis. Point number two, you gonna see hydronephrosis. Point number three, you gonna see hemorrhagic cystitis. And what are the symptoms? I told you just now. Okay. Now, how do I diagnose this patient? If this patient is coming to me, he will complain of all these things, fine, but how do I diagnose him? I do the basic test which all of you know, that is PCR chain reaction, I mean polymerase chain reaction. So when I do the polymerase chain reaction, what am I about to find is that I am gonna find viral DNA. And what type of DNA is that I told you in the starting? Double stranded circular DNA which is non-enveloped. So viral DNA, where do I find? In the blood as well as in the urine. Second important thing, what do I find in the urine? I find some specialized cells in the urine, guys. Obviously, these tubular epithelial cells and this uroepithelial cells, whatever are there, they are damaged, right? So these damaged cells also enter into the urine. Look here in the picture, I'll show you. These damaged cells also, this is the urine drop, these damaged cells also, they enter into the urine. When you very clearly look at these cells, you know how does these cells look? This is the damaged cell, damaged uroepithelial cell. Within this damaged uroepithelial cell, you will find a very big nucleus like this. Okay, such cells are called as decoy cells. Most of them, they will confuse decoy cells with a cancer, because even in cancer you will see decoy cells. So there will be a confusion. I see decoy cells, is the patient having any kind of bladder cancer? But no, he is having a virus inside. Okay. Third important thing, what is the gold standard? The gold standard, the final investigation, the gold standard. Gold standard is that I do a renal biopsy. I do the renal biopsy. This is the gold standard. Okay, so can you tell anything about the treatment part? Yes. The treatment part is that there is no much treatment giving to this patient, guys. The important treatment which you give is, patient is having immunosuppression because of that organ transplant. So stop giving immunosuppressive drugs. Okay. So the important thing is stop immunosuppression. Stop immunosuppression. Second important thing is properly hydrate the patient. Hydration is important. And next thing is bladder irrigation is important. Time to time bladder has to be irrigated. So these both are supportive care.